The goal with rheumatoid arthritis therapy is to induce a complete remission. So that means normalize the inflammatory markers and also reduce the number of tender and swollen joints. Any given drug is likely to give about 30 to 40% of patients a complete remission. That said, because we have so many drug options, we tend to be able to induce remission in the majority of patients. Patients who are taking medications tend to feel much better. They tend to be able to perform their activities of daily living, and that's what we really look for. When they come in to see us, usually once every 3 months, we look for swollen joints, tender joints, and the number of joints that are involved. And then we look for blood tests. The inflammatory markers in the blood can come and go with rheumatoid arthritis treatment, and we try to follow that over time. Compliance is a huge problem in all autoimmune disease, especially rheumatoid arthritis, and that's because the disease naturally ebbs and flows. You naturally have some flares and periods of decreased activity, and no one wants to feel like they're sick. So many people feel that they may be cured or maybe it will never come back, and they stop taking their medications. This is actually a really big mistake. First, because sometimes there's inflammation that's ongoing that you don't know about, but it's damaging your joints or it's making you more likely to develop cardiovascular disease. Also, it's much easier to control disease than it is to have a flare and then bring it back. So it's very important to continue on the medications even if you feel well. I had a patient who's a grandmother, and every summer she looked forward to taking her grandson to the water park. And because her rheumatoid arthritis was so bad, she wasn't able to play with him and do the things with him she wanted to do. And because we were able to treat her, she came in with stories of taking him to the water park and pictures, and that really just brought joy back to her life. Many of the women with rheumatoid arthritis are older, and not having the ability to use their joints means that they might lose their independence. So being able to treat them appropriately means that they have normal, independent lives.